Are you new to learning about weight medication? Well, this video is a great simple introduction to injectable medications. Hi and welcome to my channel. My name is Dr. Megan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is important because I regularly prescribe these medications. I actually talk to patients about their weight all the time, and I've helped hundreds of patients lose weight, and I'm here to help you too. So if you are confused about your weight, if you have questions about your weight medications, if you want medically based answers to your weight questions, you are in the right place. I'm starting a new patient series, and this is all about the really key, critical, basic information about weight medications, getting started with them, all the things that I talk about in my clinic. So let's dive into injectable medications. So I've made a bunch of videos about injectable medications on their own, so I'll link those down below, but this is just a broad overview for somebody who is brand new to all of this weight medication stuff. So injectable medications are the newer class of weight medications, and they were initially developed as diabetes medications. And actually, they're not that new. We've had them since at least 2010, and that is when they were first FDA approved for use in diabetes. So Liraglutide was the first GLP-1 agonist in this class that's also approved for weight. It was approved in 2010 as Victoza for diabetes, and then it was approved in 2014 as Saxenda for chronic weight management. Currently, there are 3 medications that are FDA-approved injectable medications to help with chronic weight management, and the nomenclature is very confusing, and this is why I made this video, because it's very confusing. So first of all, there is Liraglutide. That is the generic name. It is also known as Saxenda, which is the medication, that's the brand name for approval for weight loss. And Victoza is the brand name for the type that's approved for diabetes. It's all the same. You could take either one of those pens. It's all Liraglutide. It's all exactly the same. Liraglutide is a GLP-1 agonist, and it is a daily medication. It is not a weekly medication. It is a daily medication, and it's probably the least effective of the 3 medications. Patients can expect to lose about 10 to 12% total body weight loss. The next one that was approved was, the generic name is Semaglutide. Semaglutide was initially approved as Ozempic to treat diabetes, and then approved as Wegovy to help chronic weight management. Again, you could take either one. They are both Semaglutide. They're from the same manufacturer, same medication. They just put a different label on it. But they're both Semaglutide, and patients can expect to lose on average about 15% total body weight loss, which is terrific. And it's a weekly medication, so it is not a daily medication. Next medication to be approved, the most recent injectable medication to be approved, is Tirzepatide. That is the generic name. It was approved first for diabetes as Mounjaro, and then it was approved as Zepbound for chronic weight management. You could take either pen. They are both Tirzepatide. The difference is your insurance, if you're taking it for weight, is much more likely to approve Zepbound than it will be for Mounjaro. That's just how they're labeled. Now, Tirzepatide is a combination medication. It activates the GLP-1 receptors, and it also activates the GIP receptors. So it's actually activating 2 pathways instead of 1. It is to date the most effective medication we have for chronic weight management, and patients can expect to lose on average about 20% of their total body weight. And it is a weekly injection. At the time of this filming, none of these medications are generic. None of them. But Liraglutide should be available as a generic medication in the summer of 2024. So keep your eyes out for that. So that is a basic overview on the injectable medications that are FDA approved for weight loss. I have made other videos that do a deep dive on each one of these, so go check that out. If you like this video, please like, subscribe, do all the things. If you want to work with me directly, I'll leave that information down below, and please be well.